I took a year during my pulmonary critical care fellowship medicine training to do a master's of arts in education to further my education research. I took this course with a climatology professor named Professor Michael Ranney, and the course was on problem solving. And I said, this is really relevant to me. This course is really interesting to me because there's so many complex diagnostic problems in medicine, and it's hard to kind of navigate them. And he said, what do you mean complex diagnostic problems? I've watched House. It seems like you get a diagnosis or you don't. You have kind of a brilliant doctor or you don't. What is the problem-solving nature of it that you speak of? And that sparked in me something that totally changed my entire kind of research focus. That I said, wow, it is not as black and white as the episodes of House MD show us. And we as clinicians have to help patients and families navigate that diagnostic journey and that process together while encountering the vast amount of uncertainty that we face. And so that really spurred my entire research focus to say, hey, I want to help with how do we teach about diagnostic uncertainty? How do we communicate it to each other within the hospital? How do we communicate it to patients and families? And how do we also communicate this process to a larger audience as science communicators and public health communicators to help dispel that really common notion of you either have a diagnosis or you don't?
You both have touched on a very important issue about the importance of educating the people that we care for that House is not a real show. I mean, he's not a real doctor, and things are rarely that straightforward. And how do we change that paradigm that I think a lot of us have about you either have the answer or you don't?